What is joint aspiration for gout diagnosis? Have you ever wondered how doctors confirm a diagnosis of gout? One important method they use is called joint aspiration, also known as arthrocentesis. This is a medical procedure where a doctor carefully uses a needle and syringe to withdraw fluid from a swollen joint that is suspected to be affected by gout. The fluid taken from the joint is called synovial fluid. Once collected, this fluid is examined under a microscope to look for specific crystals that indicate gout. The presence of needle-shaped monosodium urate crystals in the synovial fluid is definitive evidence of gout. This identification is crucial because it helps distinguish gout from other joint conditions, such as Pseudogout, which involves different types of crystals. By confirming the presence of these crystals, doctors can make a more accurate diagnosis. Joint aspiration serves several important purposes in diagnosing gout. First, it allows doctors to directly visualize urate crystals, which is considered the gold standard for confirming gout. Second, it helps rule out other potential causes of joint inflammation, such as bacterial infections or other types of crystal arthritis. During the procedure, the doctor also assesses the physical characteristics of the synovial fluid. They look at factors like the volume, color, clarity, and viscosity. In cases of gout, the fluid may be increased in volume, less viscous, and sometimes cloudy due to inflammation. Additionally, joint aspiration can be performed on tophi, which are deposits of urate crystals that form in tissues, to confirm their nature. While doctors often relying on clinical symptoms like sudden joint pain, swelling, and redness, often in the big toe, to diagnose gout, joint aspiration provides a definitive diagnosis, especially in cases where the symptoms are unclear or atypical. It is particularly essential to differentiate gout from Pseudogout, as the latter involves calcium pyrophosphate crystals instead of urate crystals. Other diagnostic tools, such as blood tests measuring uric acid levels and imaging techniques like X-rays or ultrasound, can support the diagnosis but are not as conclusive as analyzing the joint fluid. It is important to note that blood uric acid levels can sometimes be misleading. Some individuals with high uric acid levels may never develop gout, while others with gout may have normal levels during an attack. In summary, joint aspiration for gout diagnosis is a procedure that involves extracting fluid from a joint to identify urate crystals under a microscope. This method provides a precise confirmation of gout and helps guide appropriate treatment decisions. Joint aspiration is a safe and commonly performed procedure, especially when the diagnosis is uncertain or when other joint diseases need to be ruled out. Always consult with a healthcare professional for personalized medical advice regarding gout and its diagnosis.